Welcome back to 41 Today Lifestyle, everyone. I'm over here with Dr. Harrington from Surgical Associates of Warner Robins, and we're talking all about breast cancer and, you know, the issues around it, when we should be talking to our loved ones about it, and also the treatments of it. Welcome to the show, my friend.
Thanks for having me.
All right, so let's talk a little bit about, you know, the awareness, okay? We see a lot of commercials about it. We think we know about it, especially husbands and wives talking to each other. We may have known someone in our family that has gone through it. When should we start having a conversation about it and making the awareness in our home with our young daughters?
I don't think there's never too early to start a conversation, but I would recommend for mothers with daughters to start talking to their daughters at around the age of puberty.
Really?
To do breast examination once a month.
Okay. Now, when you say breast examination, is that something that we need to come and see someone like you to find out how we're doing it properly and what we're looking for?
So it's generally recommended for young females, again, once they are in pubertal age, to have to be set up with gynecologists. So that's the opportunity,
right,
to know how to do proper breast exam. And then later on, the primary care physicians can also provide the information.
All right. Now, that conversation should be happening, as you were saying, from puberty. But what about if maybe auntie or our grandmother has gone through breast cancer? At what age should we be doing mammograms?
So for general population, without any risk factors, it's age 40. However, somebody who is at a high risk of breast cancer, either with strong family history of breast cancer, those women should start earlier.
Okay, are there signs, apart from feeling a lump or something a little bit protruding in breast cancer, are there signs that you may have breast cancer?
You may or may not. I would say today there's more newly diagnosed breast cancer in women with no signs, and it's just because we have such a good screening tools, like mammogram. However, there are still women who will have symptoms. Besides lump, as you mentioned, it could be abnormal skin changes like dimpling, swelling, could be discrepancy in a breast size, could be also breast pain, breast redness, nipple discharge, or nipple rash-like changes, or eczema.
That's really great, because I didn't think there was so many other ways that you could maybe have a site that you may have breast cancer. Where do you sit in regards to women who have breast implants having mammograms? Because the conversation out there, and a lot of people talk about it, that if you have implants, you can't be detected properly when you have or may not have lumps.
So today we have 3D mammography, which is excellent tool for detection of breast cancer, even in the women with implants. And we also have MRI. So a lot of women who had breast implants in the past are eligible for MRI.
Yeah.
And that's not a great modality besides 3D mammography.
Okay, what do you recommend for genetic testing? Because, you know, breast cancer is quite common, right?
Very common.
And, you know, still to this day, a lot of women don't do anything about it. How can we test? Is there home testing for genetic testing? Is there, talk me through that.
Okay, so it's very simple test actually. It's done either from blood or saliva or mouth swab. The sample is sent to a lab, and they will test for mutations in what we call DNA repair genes, which we know that they are associated with a high risk of breast cancer. You've probably heard about breast cancer gene 1 or 2, possibly others. But it's a very simple test, and there are groups of women who should definitely consider it.
Well, Dr. Harrington, great information. You really did open my eyes, and I've been doing this a long time, and you gave me some good pointers as well for my lady friends in my life as well. If you want to find out more about Dr. Harrington and Surgical Associates of Warner Robins, there it all is up on the screen for you. Give them a call, ladies. They will take care of you, and Dr. Harrington has great information. Back after this short break.